With this said, I'll go back to Andrew, and we kind of carried on some of that discussion, but we'll go a little bit more details. Tell us a little bit more about this mutual exclusivity in cholangiocarcinoma of the different mutations.
Yeah, so this is a very, very interesting concept, meaning that certain tumors probably rely on certain pathway to drive the carcinogenesis. So in other words, if you have a very strong oncogenic driver, you actually do not need additional mutation. So that's actually manifested by the mutual exclusivity, as you mentioned. That's actually not a very characterized field at this moment, but I think increasingly, we have evidence that the IDH and the FGFR2 fusion, they seem to be mutually exclusive. In other words, if you see the IDH mutation patients, when you do the other additional testing, usually you don't see the FGFR2 fusion and vice versa. But I do think that there are a more detailed work that needs to go into this space. Even though these two are mutually exclusive, but you may actually have additional mutations going either with the IDH mutation or with the FGFR2. And those coexisting mutations still will provide very important insight figuring out the combination treatment in the future. Yeah.
Fair enough. If anything, we're hearing about what we called, humbly and proudly, we called from Memorial at one point, mutual exclusivity of genetic alterations, or MEGA, that was published already, where actually, as Dr. Zhu just described, and we're not the only one who at least found the phenomenon, was described by different groups, including MGH, including MD Anderson, where pretty much if a tumor actually has a IDH1 mutation, it's unlikely to have an FGR fusion change, and vice versa. And of course, however, as Dr. Zhu mentioned, there could be some other alterations in between. And by the way, just to recite how complex that is, even though we're focusing on the IDH1 and FGFR2, and you'll understand why, but in addition to that, we have EGFR overexpression. We have, if anything, the HER2 amplification. Maybe it happens more in gallbladder cancer, but can happen also in cholangiocarcinoma, BRAF mutations, and of course, ROS1 rearrangement. So it's really an importance to make sure that we get as much information as possible for either having a clinical trial. Hopefully we'll have some therapy that we can apply. And of course, as Martin mentioned, and he is an expert on that in regard to referral to a phase one, new therapy development that could be, available for a certain patient.